Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. See, it is very important as a varicose vein patient to understand the anatomy and physiology of veins of lower limbs. See, when you take a leg like this, you will have a leg like this, and there are two types of veins. One that is running internally in the middle of the leg, in the muscles of the leg. Those we call as deep veins. It will be embedded deep in the leg, and also around the leg, just below the skin, there will be some veins. We call it as superficial veins. So, how to name these veins? In deep veins, we will name according to the arteries. We will have femoral vein and popliteal vein, anterior tibial vein, posterior tibial vein. These are the veins located deep inside the leg. Around the periphery of the leg, just below the skin, we have two veins. One is great saphenous vein. Great saphenous vein starts from the ankle and it goes into femoral vein at inguinal region. This is a peripheral vein. And also there is one more peripheral vein. We call it as superficial saphenous vein or short saphenous vein. It starts from the back of the ankle and it will be inserted into the back of the knee into the popliteal vein. See, these are the constructions of veins. So, deep veins and peripheral veins. They drain the blood in the leg to the heart. They carry the blood, that is venous blood, from the legs to heart. And there is a connection between these superficial veins and deep veins. We call them as perforating veins. So, perforating veins run horizontally, whereas deep veins in the middle and peripheral veins on the outside will run vertically, and these run horizontally. So these are the connections. These peripheral veins and superficial veins or deep veins are connected through this perforating veins. This is the structure. The blood is always drained from peripheral veins or superficial veins to deep veins through these perforating veins. And the important structure we have here are the valves. Valves means there are made of these are the structures within the veins which open in one direction. That is, they allow the blood to flow only in one direction, from below to above. When the blood tries to come below, they will close and they will not allow the blood to come downwards. When the blood come from below to upwards, they will open and they will drain the blood. They will not. There are valves. They allow the direction of the blood in only from below to above direction. So these are the functions of this valves. And coming to the physiology, so why do we need veins and arteries? We need arteries to supply the blood to the lower extremities. And why do we need veins? Once the blood is used or oxygen within the oxygenated blood is used by the legs, blood has to be again carried to the heart so that it is again reoxygenated. So the veins will return the blood from periphery to the heart, and arteries will supply the blood from heart to periphery. And there are two types of veins. We said deep veins and superficial veins. These communicate through perforating veins. All these veins will have valves that will allow blood only in one direction, that is from against the gravity. That is against the gravity from below to upper part of the body to the heart, inferior vena cava, and then to the heart. This is the structure and function of the arteries and venous supply of lower extremities from the perspective of varicose veins.